So during this ESMO, we reported the final results of the CheckMate 238. CheckMate 238 is a randomized Phase III trial which compared Nivolumab versus Ipilimumab, an active comparator arm, in high-risk melanoma patients as adjuvant. That means patients with stage 3B, 3C, and 4 resected. The final results confirm, in terms of relapse-free survival, that Nivolumab is better than the active comparator Ipilimumab. Even in terms of distant metastasis-free survival, there is this trend of a superiority on Nivolumab versus Ipi, and even with the progression-free survival too. That means the progression from the first progression to the second progression. Nivolumab continues to be better. Overall survival, no difference, really similar, with just some point of percentage in favor of Nivolumab. But this can be explained that the active comparator arm Ipilimumab patients were treated at progression with anti-PD-1, was a sort of crossover, and the overall survival looks really similar. Anyway, the message is Nivolumab continues to be a treatment that we should offer to our patients because it's less toxic than the Ipilimumab, showed the better relapse-free survival, PFS2, distant metastasis-free survival, and even if the overall survival it's similar to Ipilimumab, means that it's similar to an active comparator arm. So compared to nothing, it's surely better. There is another interesting post-hoc analysis with this trial, which is how could be important the time of the administration of a drug, because during ASCO we've seen several reports that this may make a difference in terms of efficacy and safety. And we have seen, in terms of relapse-free survival, for the patients where the majority of cycles were done before 1 p.m. or after 1 p.m., the majority means more than 75% of the cycles. For the pooled analysis, for the patients treated with Ipilimumab, relapse-free survival was better in the patients treated before 1 p.m. compared to 1 p.m. Not significant, but interesting. For Nivolumab, similar results before or after 1 p.m. Overall survival, similar results. Safety, for both Nivo and Ipi, during the morning, there was a small less side effect compared to the afternoon. Having said that, these data are interesting, but we need to confirm this in a perspective study in other analysis.